newborn babies are special, but one born in Dallas last month has made medical history. On this week's edition of Today's Health, we meet the first baby born in the United States to a woman with a transplanted uterus. Erica Edwards has a story.
The sweet sound of success. A baby boy delivered by C-section last month at Baylor University Medical Center at Dallas, the first in the country to be born following a uterine transplant. The physicians who made it possible were clearly moved by the experience.
There was something about this that was so special. Sorry, I'm an emotional person.
The baby's mother, who is not being identified, was born without a uterus. She's one of 10 women undergoing uterine transplants in a clinical trial at Baylor. The donor is a Texas mother who volunteered to give up her uterus just so another woman could experience pregnancy.
We are very humbled by understanding the depth of the desire of a woman to carry her own pregnancy.
The trial has not worked for everyone. At least 3 uterine transplants at Baylor have failed. The new family released a statement reading in part, "We humbly hope that our little boy can serve as an inspiration to those struggling with infertility and demonstrate throughout his life that no matter what obstacles are in your path, with the right team working beside you, anything is possible." While this has been a medical first for the U.S., it will not be the last. Another Baylor womb transplant recipient is pregnant. Erica Edwards, NBC News.
This is only the 9th baby in the world to be born following a uterine transplant. All others are in Sweden. In other health news, deaths from opioid abuse have skyrocketed over the past 15 years. That's according to a new study from Harvard University. It shows people hospitalized for an opioid-related condition are 4 times more likely to die now than they were in 2000. Researchers say the increase is likely due to a spike in opioid and heroin poisonings. These patients are more likely to be white, low income, and disabled. A separate study finds a rise in overdose deaths from cocaine among African Americans. Government researchers looked at death certificates between 2000 and 2015. They found cocaine is killing blacks at the same rate heroin and prescription drugs are killing whites. Experts say better strategies are needed to prevent deaths from both cocaine and opioids. Finally, a new study suggests there are still significant racial gaps when it comes to cancer survival. Government researchers found black women were much more likely to die from ovarian and breast cancer in 2009 than white women. African Americans were also less likely to survive from colon cancer and tended to be diagnosed at a more advanced stage of the disease. That's it for this week's edition of Today's Health, and coming up on KPVI News Today, we take a look at your KPVI News Today headlines.